So I'm Shannon Small. I am a double board surgeon in trauma, emergency surgery, and surgical critical care. I'm in my ninth year of practice. I'm an assistant professor of surgery at Yale. And honestly, I became interested in surgery from day two of medical school. Day one, all we did with our cadavers was just kind of enter the lab. Day two is when we flipped them over and actually started dissecting. And from then on, I was like, yeah, I need to cut and I need to be able to see and figure out how things work. So started scrubbing in with a surgeon in medical school from M1 year and kind of never looked back. That's a really good question. I think, and this is particular to trauma critical care, it's the access to care issues that a lot of my patients face. You know, a lot of trauma or emergency surgery patients or patients who come through the ER who may be underrepresented or underserved. It's not being able to get that patient to the operating room in a timely manner or losing them to follow up because they don't have childcare or transportation to get to their clinic appointments. Um, and I think, you know, for me, I'm very big into community outreach and diversity, equity, and inclusion initiatives. And that's part of how I balance that frustration is by trying to change the system rather than just complaining about the system. AWS has sort of been my surgical home since I became an attending. My first place of employment, I was the only female surgeon and one of the only female physicians on staff. And I was a new mom, um, breastfeeding and trying to manage a new practice with an infant. And I just did not see my needs at the time reflected in other national organizations. And so I joined AWS partially for the support and being able to sort of talk to other surgeons who had gone through the same thing. And then also just kind of the sense of community that it provided. That you can have work-life balance in surgery, which I feel like I didn't get that messaging a lot when I was a medical student. It was a very and or an either or where you can either be a really great strong surgeon or you can have a family life. And I don't think that messaging is true at all. And it's definitely not true now. Diversity in surgery means that when I walk into, say, a faculty meeting, that I'm going to see representation of myself, representation of others. I like seeing a very well-rounded residency and program with women, underrepresented minorities, members of the LGBTQ community, because that's what our patient population is like, right? And our patients succeed when they see themselves or they see allies who can help them. And ultimately, that's what it all boils down to is the care that we provide our patients. Um, Additionally, because my career path has been a little non-traditional, I think it's important to remember that non-traditional career paths also can help um, and bring different voices to a program. So a non-academic path or you know, having a few different areas of expertise or having your own side business or things like that. That's also a diversity to me because not everybody is a cookie cutter surgeon that went straight through college, medical school, you know, academic program, academic fellowship, academic job. It makes me think of Ruth Bader Ginsburg when there are nine. I think when we no longer have to talk about what the future of women in surgery looks like is when we will have achieved my personal vision. When it's not, when we don't have to count the number of female chairs of surgery, when we don't have to count the number of full professors of surgery, um, that is when we will have achieved, I think, my vision of the future of women in surgery. Support, honesty, be true to yourself, helping people feel better. It's what I was meant to do.